Hello, my name is Dr. Julie Philly. I'm the Executive Vice President of Health Affairs here at the University of Texas at Tyler. We have so many wonderful academic programs that address so many different disease states, but I can't think of one that I'm more proud of or more excited about than our psychiatry and behavioral medicine programs. We understand that in our state, in our region, in our country, in our world, we have a real crisis regarding mental health. We have a lot of people in trouble, and we want to do everything that we can to provide services to help these individuals. I'm so excited that Dr. Beverly Bryant has joined our team as the chair of psychiatry, and together with multiple colleagues across multiple divisions, she's going to help us address these very important issues. One of the most important things is our children and our young teenagers, our adolescents. Dr. Bryant is going to lead the charge to start child and adolescent fellowship programs to help train physicians and others to help those in the most need.
I'm Dr. Beverly Bryant, and I'm very excited to introduce the Child and Adolescent Psychiatry Fellowship here at the University of Texas Health Science Center at Tyler. We have a crisis for children in terms of mental health in our area and in our country. It is so important that we increase the workforce in child psychiatry. I'm excited to say that we have two residents that have joined the fellowship already to start in 2022. And here at this institution, we have such a depth of talent to offer our trainees. Our Child Psychiatry Fellowship will focus on the entire family and not just on psychopharmacology. It's important to know how to prescribe medication, but it's equally important to know about evidence-based psychotherapies. So a big part of our program, a big part of our training program will have to do with learning evidence-based care, family intervention, parent management training, trauma-informed care, and advocacy. We are excited to bring more child psychiatrists to East Texas, and we will be able to interact with many learners. We have learners from nursing, social work, psychology, and pharmacy. So our hope is that we will have a comprehensive child and adolescent psychiatry fellowship that will allow cross-pollination between specialties and a supportive environment for making that transition into becoming a child and adolescent psychiatrist. When you become a child and adolescent psychiatrist, you become part of a national family that is devoted to child advocacy and education. Certainly education, clinical research, evidence-based care are crucial parts of our program. I'm also excited to mention that we have the Texas Child Mental Health Consortium, sponsored by our state legislature. This consortium consists of all of the medical schools in Texas and supports interventions, supports programs for consultation to primary care physicians, as well as to school districts across the state. It's also involved in two very important research initiatives, one on trauma and one on suicide. So when our fellows come here to train, they have the ability to utilize the resources from that consortium and reach out to other medical schools and interact with professionals who are at the top of their profession in child psychiatry. So we are very excited about it, and really invite people to come and grow with us. There's a saying from where I trained, never worry alone. And that is really the motto for our Child Psychiatry Fellowship as well. We want people to learn to lean on each other, utilize assistance and professionalism from other areas, and provide the very best evidence-based care possible.
My name is Dr. Mary Carr. I'm a third-year psychiatry resident at UT Health Science Center in Tyler, Texas. One of the things that I think is unique about completing my child and adolescent psychiatry fellowship training out here in East Texas is the fact that we have such close access and work with the state hospitals that are here in our region. I think that the state hospitals offer a patient population that is very unique, and a lot of other programs in the state and in the country in general don't offer you that ability to interact with that type of patient population. One of the reasons why I decided to stay here at the University of Texas Health Science Center in Tyler for my child and adolescent fellowship is the fact that there will be the opportunity to have continuity of care that is going to be a really unique aspect for the fact as a resident here, I am seeing children right now, and I can continue to see them while I'm a fellow. And that's something that I think that a lot of people don't have that opportunity if they aren't kind of continuing where they did their initial training. One of the things I really enjoy about being a resident out in Tyler, Texas is the environment that's out here. I like the state park. It's really great to go out and explore. Rose Rudman Park is an excellent place to go and hang out. I go out there and I walk my dog all the time.
My name is Michael Watkins. I'm a third-year psychiatry resident here at the University of Texas Health Science Center at Tyler. I chose the Health Science Center here in Tyler for three reasons. The number one reason being the program director. She's very experienced at what she does. She's previously been a program director of child and adolescent fellowship programs. She's directed inpatient unit, child and adolescent inpatient units. She's directed eating disorder clinics, so she's very experienced at what she does. Two of the other reasons that I chose the program were for the lifestyle here in Tyler. Tyler has a good mix of rural amenities, city amenities. A lot of outdoor activities, but as well, you have tons of restaurants, things to do, even a symphony orchestra here in Tyler. By completing the Child and Adolescent Fellowship here at UT Health East Texas, I will benefit from that, from interacting with the different populations, rural, urban, suburban, and that sets me up well for the future. If I decide that I'd like to go practice in a rural setting, I'll be very familiar with that population. Likewise, we have enough urban clients or patients that I'll be familiar with their unique needs. Or if I decide to do private practice in a suburban setting, I will see patients from that setting to be comfortable with treating them.
Many of the perks of residency training at the University of Texas Health Science Center at Tyler revolve around what Tyler has to offer. Tyler is a culturally diverse city of over 100,000 people with an excellent cost of living that is well below that of larger cities. We are situated just 90 miles east of Dallas and within only a few hours of Houston, Austin, and other Texas metropolitan areas. Tyler is known to outdoor enthusiasts for its beautiful countryside while also boasting excellent shopping, restaurants, and a number of arts and educational venues. With its charm and hospitality, it does not take long to fall in love with East Texas and all that it has to offer.